Good evening, Team Kentucky. Good evening, Virginia. This is Lieutenant Governor Jacqueline Coleman here to give some good news items. And I'm going to kick it off with a very special economic development announcement that really demonstrates the resiliency of Kentuckians. On December 2nd, Wholesale Hardwood Interiors was hit by a disaster when a fire broke out that resulted in a near total loss of its headquarters in Campbellsville. Only about 20,000 square feet of the 120,000 square foot operation was able to be partially salvaged. Now, only 3 months later, the company is not only back in operation, but it is also growing its presence in Taylor County and creating new job opportunities for Kentucky residents. WHI is moving forward with plans to construct a new facility at its existing location on the Campbellsville bypass, expected to be fully operational within 12 to 18 months. The company is investing a little over $7 million into this rebuilding and expansion effort and will create 100 full-time jobs in the process. Clearly, this is tremendous for WHI, Taylor County, and the Commonwealth. The company has operated in Campbellsville for 35 years, growing to include 12 warehouse locations throughout the state. WHI employs over 100 people in total, with warehouses in Bowling Green, Elizabethtown, Lexington, Louisville, Richmond, and Walton, as well as facilities in Indiana, Ohio, and Tennessee. This is a company that has an impact throughout our state and the surrounding region, and its recovery and continued success is important for so many Kentuckians and so many Kentucky families. We've spoken a lot about our effort to build back stronger than ever in Kentucky, and we're building something special here in Kentucky, and we've been doing it with companies like WHI. So I want to thank everyone at Wholesale Hardwood Interiors for their commitment to the Commonwealth, and I look forward to seeing the company reach new heights in the years ahead. My second piece of good news, I'm actually going to call this excellent news. So we've got two good news items and one excellent news item. This has to do with the Kentucky Broadband Initiative. And as you know, our administration has been committed to providing broadband internet connectivity to every single Kentuckian, no matter where you live, because we understand that closing the digital divide is critical for economic development, for education, and for creating the jobs of the future right here in the Commonwealth. So in January, we announced the Speed Test Kentucky, an online internet speed test that helps us map broadband coverage and connectivity across the state. The speed test will remain active for 1 year, and Kentuckians can continue to take the test. But we set a deadline for March 1st so that we maintain that sense of urgency as this is a priority for our administration, and we won't rest until we fulfill our promise. So as of our self-imposed deadline of March 1st, I'm happy to report that over 81,000 Kentuckians have taken the speed test. This is a great response, and I'm going to give you some comparisons from other states in the country, and then to let you know what our national partner has said. In 1 month, we have outpaced much larger states that began their speed tests 6 months ago. Geo partners called Kentucky a shining light and said that we accomplished in 6 weeks what other states have accomplished in 6 months. With over 81,000 completed tests, Kentucky has more than double the number of tests as the next highest state. This is another example of Kentucky leading the way, which means we now have enough data to put together a strategic plan to build out broadband service in Kentucky. Even still, we do need more responses from a few counties. So if you live in Christian County, Bullitt County, Boone County, or Jefferson County, we really need you to go to speedtest.ky.gov to help us to collect more data. But with the data we do have, what we do know is that there are 71 counties that are able to move forward with grant funding requests. That's pretty remarkable, especially for a 6-week time span. We're doing this, of course, as quickly as we can, but it will be an ongoing project as we continue to collect data from across the state. So I want to give a huge thanks to our partners who made this such a great success and has really helped Kentucky emerge as a national leader in this work. I also want to thank every Kentuckian that took 30 seconds out of their day to make sure to help their neighbors in need. So remember that if you still haven't taken the speed test, we still need you to. The more data we have, the better work we can do. And so you go to speedtest.ky.gov to take that test and to give us even more information to build an even stronger foundation here. We're really excited about getting to work laying the last mile for Kentuckians across the Commonwealth. So thank you. And our last piece of good news here. The sun has been shining, so I've got really good news about getting outside. We have great news for 12 Kentucky communities today. I'm excited to announce more than $692,000 from the Recreational Trails program has been awarded to improve parks and recreational spaces across the Commonwealth. RTP is a competitive federal program aimed at improving communities and enhancing quality of life, which aligns with our goals here in Kentucky. So safe green spaces provide a place for our families to exercise and spend quality time together, allowing you to get out of the house, especially after a year of surviving a pandemic. So as we work to build a better Kentucky, those quality outdoor spaces will help us to continue to build world-class tourist destinations here in Kentucky. These improvements will attract tourism dollars. They will strengthen our economies as we work to reinforce our post-pandemic economy and build the better Kentucky we've always imagined. So let me read off a few places here that are going to receive some funding. Carroll County will receive $35,750. Franklin County, $20,000. Garrett County, $44,804. Harlan County, $200,000. Hart County will receive $100,000. Henderson County will receive $37,184. Martin County will receive $14,829. Perry County will receive $34,746. Shelby County will receive $125,000. Madisonville will receive $20,000. Morganfield, $21,274. And last but not least, Corbin will receive $38,471. So these selected applicants must still undergo an environmental review and receive clearance from the Kentucky Transportation Cabinet and approval by the Federal Highway Administration before receiving the funds. So congratulations to all of the selected communities. Because of your work, families in all corners of Kentucky will have access to better parks and recreational spaces, and we all know we need them at this point. So I'm very excited that the vast majority of these projects are in rural Kentucky. As a rural Kentuckian, I know how beautiful our entire state is, and I want us to make sure that we are invested in every area of Kentucky, and I'm grateful to have the governor's support in that. So we look forward to the completion of these projects and the prosperity that they will provide across the Commonwealth. And that wraps up our good news today. So Governor, I'll turn it over to you.
Thank you to our Lieutenant Governor. And before we get into the COVID report, just a quick update for all of our Kentuckians who have suffered due to the recent flash flooding and or the ice and snowstorm. FEMA is on the ground evaluating both events right now in its first set of counties. I have spoken today with our contact in the Biden administration, stressing how critical this is and the importance of individual assistance. And we are going to continue to push that. To anybody out there who lost their home, had it damaged, or the rest, please document each and every one of those losses. It's going to be critically important because if we can get individual assistance, it'll provide $30,000+ up to that can help individuals. We are going to push just as hard as we can for that. I want to thank those out there that are providing goods and or are holding the telethons that we are seeing. There have been multiple of them to help those in need. You are not alone. You are not alone. Our National Guard continues to be on the ground. Help is there, and we are going to help you rebuild. Remember, it's about 30 days from the event till when we can get a presidential declaration. It takes documentation. It takes a full submission. We are working towards that right now. All right. Let's recap the last week in COVID. We had our 8th consecutive week week of COVID declines. Remember, we had never had 4 consecutive weeks before this current set of declines, and we are now down to pretty much where we were in September as the numbers had just started taking off. This is the exact type of trajectory we want to see as we are vaccinating people. This is, in many ways, a race against time against the variants. If we can continue that downward trajectory while increasing the number of people vaccinated, then we can hopefully get to the end of this thing sooner rather than later. The president has made a promise that all adults that want to be vaccinated will have an opportunity to get at least their first shot by the end of May. And so that means we got to keep hustling to make sure we continue to see these numbers drop. Just as positively is the positivity rate. It continues to decline. Last week, being just at about 4.12%, which again is the lowest since at least periods in October, if not before. Remember, this is a leading indicator, so it is positive news of what we are going to see moving forward. Some states have plateaued. We don't want to see that. We want to see continued declines, and as we do, it'll give us more opportunity to either increase capacity for certain things, reduce restrictions. We got to do that right. We got to do it incrementally because we are so close to the end. We don't want to sacrifice Kentuckians along the way. Good news, our hospital capacity is in good shape. The inpatient census, well, that's the hospital capacity across the state. 2 areas in the red zone. Neither of them are concerning for us right now. They're both about ICU bed space. One just barely hits the red mark, but plenty of capacity around. Let's look at the inpatient census graph. As you can see, the number of Kentuckians in the hospital for COVID has plummeted, and we want to see it continue to fall. In the ICU as well, this means not only are less people getting sick enough to be in the hospital, less people are getting sick enough to need the ICU bed when they're in the hospital. Kentuckians on a ventilator also decreasing. This is good news, and we want to see it continue. In that vein, today's report is one of the better ones we've had. Today, we're reporting just 331 new cases of COVID-19. That is the lowest since September 14th. Everything's down. Kentuckians currently hospitalized due to COVID, 539. Currently in the ICU, 161. Currently on a ventilator due to COVID, 82. Our positivity rate today down to 4.06%. We want to see that continue to decrease as well. We're reporting 10 new deaths today. A 76-year-old man from Boone County, 2 men from Fayette County, ages 74 and 93, a 66-year-old man from Franklin County, an 80-year-old woman from Harrison County, a 62-year-old man from Henderson, 2 men from Jefferson, ages 83 and 84, a woman from Logan, age 63, and a 73-year-old man from Muhlenberg. Some of the best news that we see is in long-term care. Just 3 of those 10 individuals, 30%, were long-term care residents. Again, that's plummeted from 2/3 to 1/3 or less. Just 3 new resident cases, 8 new staff cases, 2 new deaths attributable to long-term care. Given the vaccinations that are out there and a few other updates, we have Dr. Stack today to talk about the new CDC guidance. For those that have been vaccinated, it should be a very good incentive to get vaccinated on what it does, but also what it does not allow, as well as an update on a couple new cases of the variants that we are seeing here in Kentucky. So over to Dr. Stack.
Good afternoon, everyone, and hello, Governor. So I'd like to give you these few updates that the Governor mentioned. So today, the CDC released new guidance. The guidance is to give information to people who are fully vaccinated and what restrictions may be able to be removed for those people who are fully vaccinated. There's a lot, forgive me. There's noise here in my neighborhood, sorry. So there's a lot of information in these in this document, and it's going to take us some time to kind of think through it and what the implications are. But I'll break it down, if I can, into a few big buckets. First of all, for people who are fully vaccinated, so this will be for adults who are fully vaccinated, the CDC is now saying that those individuals within their own households can gather in small groups with other fully vaccinated adults. Of course, people under 16 are not yet eligible for the vaccination. It's not authorized for them. But for the households where all the adults are fully immunized completely through the series and 2 weeks past the second dose for a 2-dose series, you can gather in small settings. They don't specify the numbers, but in small settings in your private household. If, though, vaccinated and unvaccinated people mix together in a gathering, in those instances, generally you should still practice social distancing and wear your masks, with a few limited exceptions. And they pretty much make an exception that sounds like our current guidance in Kentucky, that 2 households or a maximum of 8 people could get together if you had a mixture of vaccinated and unvaccinated. So maybe use that in Kentucky for a placeholder until we get more information on this. The other guidance, and this is really important, is when you are out in public settings, whether you are vaccinated or not, the CDC is still asking everyone and urging everyone to please wear your mask, socially distance, practice your hand hygiene and cough hygiene, cough into your sleeve, not into the open air. And please continue to do those behaviors until we get everybody vaccinated, particularly the most vulnerable in society. Additionally, there is no change to the travel guidance. So there has been no relaxation of travel guidance by the CDC yet in relation to vaccination status. So please, this is good news. This is a big development, but we have to be careful. A real concern I think most public health professionals have is if people misinterpret this as we don't have to pay attention to the virus and we don't have to do our masking and social distancing, that would be a mistake. If we do that, we run the risk of supercharging the pandemic when hopefully we should be getting near the end of the pandemic. And along those lines, we found some more cases of the B.1.1.7 variant of COVID-19. That's the strain of the virus, the mutation that was first found in the United Kingdom. At this point, it is inevitable that it will continue to multiply and expand in its presence in the state of Kentucky, unless we take all of the important public health measures of masking and social distancing, and we all get vaccinated as soon as we are able to and have access to it. So please, when it's your opportunity to get vaccinated, I sure hope you'll accept the vaccine. It'll help keep you safe, your loved ones safe, and our community safe. And then the final point related to the vaccines, we still have not yet received guidance for long-term care facilities and assisted living facilities that are regulated by the federal government through Medicare or Medicaid. We are as eager as family members and residents of those facilities are to give new guidance and allow enhanced visitation. We have already done that in sittings or situations or settings where we have the ability or the authority in Kentucky to do so. But the federally regulated facilities are going to have guidance from the federal government that permits that visitation. As soon as we have that, we will look forward to releasing it and making sure you have access to that so we can safely get back to seeing our loved ones and enjoy each other's company. So good news on the vaccine front, and we're going to keep working as hard as we can to expand our network and get everyone the chance to get vaccinated as soon as supplies make it possible for everyone to have that opportunity. So thank you very much for all you've done, Kentucky, and back to you, Governor.
Thank you to Dr. Stack. I think that last point, we still hear some that are confused. It's mainly the skilled nursing facilities that are covered by the federal government through Medicaid and Medicare. We are waiting their guidance. Those other facilities that are not, we've allowed enhanced visitation where everybody is vaccinated. I know a lot of people are getting to see their loved ones. If your loved one is in a facility, though, that is governed by the federal government, we understand you're anxious. We hope that they will come out with their guidance very, very soon. All right, let's move to vaccines. Let's start with Table 2. Remember, the week of February 23rd had been the most vaccines we had ever put in people's arms in a single week. With 1 day to go this week, we have already surpassed it. So this week, and remember, our vaccine weeks run through Tuesdays, Tuesday through the following Monday, because that's when we get the vaccines each week. We've already vaccinated 113,811 individuals, and we have one more day to go. We are catching up from that large amount of supply we got after weather delayed it for a week, and we are excited about how many Kentuckians right now are getting vaccinated. If we look at Table 1, currently in Kentucky, we now know 834,130 individuals have been vaccinated, and that's through the various programs, state and federal. That means certainly for population over 18, you can only get 2 of the 3 vaccines if you're over 18. We have vaccinated 25%, more than a quarter, of the eligible population in Kentucky. So a year and 2 days after the very first case of COVID in Kentucky, again, we have 3 highly effective vaccines, and we vaccinated a quarter of our adult population. We want to move forward even faster, but I think that's something we should all be very thankful and grateful for, while at the same time working to make sure each and every one of you get that shot of hope as soon as possible. Going through the demographics, which we do on Monday, of the vaccines, let's start with age. So as we look at age, about 36.4% of all our vaccinations have been age 70 and up. 70% of all of our vaccinations have been age 50 and up. That's a good sign. Let's move to gender. We're 60-40. Again, we think that this is going to balance out a little bit more, but we are trying to see if there is more hesitancy. Some of the national polling has suggested that amongst men. Ethnicity, 98.87% non-Hispanic, 1.13% Hispanic. And then on race, we've ticked up just a little bit, but still a long way to go. White, 86.21%. You see Asian, about 1%. Black or African American, now up a little to 4.77%. We still need to do better. We are being intentional. We have a number of community clinics that are currently operating and will be in the coming weeks, in the coming months. I want to thank all the leadership out there that's helping to make that happen. That came from community conversations where leaders in those communities proposed what they believe would work best to get the most people vaccinated and to address historical hesitancy that certainly is justified. Those are the demographics that we have today. Again, we will continue to work on an equitable distribution of this vaccine. That's not just a value, it's a requirement of this program. With that, we will open it up to questions. We'll start with Joe Ragusa from Spectrum.
Hi, Governor. So I have a couple questions really about some legislative stuff. I wanted to ask first what your thoughts are if you've seen Senate Bill 169, which is a bill enhancing benefits, permanent disability benefits or retirement benefits rather, for those who have to medically retire, first responders who are injured in the line of duty. And also kind of in a more general sense, lawmakers sent a slew of bills over to your desk on Friday, including a few bills I know that you were in favor of, Senate Bill 7, the unemployment overpayment benefits bill, and Senate Bill 67, the alcohol to go bill. So what are your thoughts with the bills that they passed on Friday?
So I've not had an opportunity to fully read Senate Bill 169. Certainly, we want to be there for our first responders who are harmed on the job. I want to read through all of that. A lot of the bills passed on Friday weren't enrolled, meaning they couldn't get to my desk And because one of the chambers had adjourned, we expect to get a whole lot of them when they come back in session. Certainly, there are a number of those bills that I will sign, that I am in favor of. Actually, there are a couple that reach my desk that are critically important. Taking federal health care reform and putting the mental health parity into state law is something that I've been pushing for a number of years. So that's really exciting. Cap on insulin, incredibly exciting too. Alcohol to go, which is another one of those that's come out. So I think you're going to see that while I vetoed a number of the early bills, which I think everybody expected, there's a lot of them that are coming to my desk that I will sign, and I'll be proud to sign. That'll help move us forward. It seems like the legislature is definitely focused on a number of important areas now, healthcare being a big one, and that's good to see. Now I know that a lot of their attention is turned to the budget, which is critically important. We have the dollars to invest. We have the dollars. Now is the time that we're going to determine our post-COVID future, our role in the new economy, and we got to be bold. And no one's ever been at the point where we are, where you don't have to borrow to stimulate your economy in the midst of a recession. So of course we should do it. Mike Valenti from WLEX.
Yeah, thanks, Governor. You've talked a lot about the importance of passing another COVID relief package. It looks like that will happen. The House is slated to vote on that tomorrow. But I want to ask you about a provision that is not in the package, which is the minimum wage hike to $15. Obviously, we know the Senate parliamentarian ruled that it couldn't be included in budget reconciliation, and the Senate removed it after it was passed through the House version. Would you have liked to see the minimum wage provision included in that bill? Do you support the minimum wage increase to $15?
So first, let me say the America Recovery Act is critical to get passed. It's going to provide more than $2 billion in state aid to help us do really important things in Kentucky that can generate jobs now. Water and sewer projects. Just think about it. We could use these dollars to ensure that every Kentuckian has access to clean drinking water. How long have we wanted to make that a reality? That's possible there. You can use those dollars on broadband. The House has certainly pushed a bill that has a substantial broadband investment in it. This can just add more. You can provide significant relief to households, to businesses, to industries. We pay off the UI loans. So it's going to be incredibly important for us. And that's just on the state level. There's about another $2 billion that'll go to cities and counties, an opportunity to do some really special things that help us sprint out of COVID into a bright future. And if we do it in a smart way, reduce future expenditures by attending to our infrastructure needs, the ones that we can, water, sewer, broadband under the bill now. I do think the minimum wage needs to be raised. I think that it's a more complicated conversation, though, than just picking a number and saying it should hit that mark, because I believe that your total compensation is wages plus benefits. And if we raise the minimum wage to a certain level, but people aren't getting health benefits, for instance, then their total compensation isn't what they need to survive. Whereas, if you were talking about $15 an hour and no health care versus $13 an hour and health care, they're different. It's not apples to apples. So I certainly believe the minimum wage needs to be increased, but I think we have to have the conversation with the benefits that are offered so that we truly can reach that point where everybody can get by on the salary or the wage that they're paid. Chad Hedrick from WKYT.
Hi there, Governor. I wanted to ask you, Ohio Governor Mike DeWine has said that state health leaders there say that for 2 weeks they need to see 50 cases or less per 100,000 before they're able to start lifting health restrictions and orders. Are you looking at having some similar threshold in Kentucky to say, okay, once we hit this amount of cases per 100,000 or however long, we can start lifting more orders?
Well, we certainly at least adjusted an order recently to allow more capacity in just about every part of our economy, provided that you can have the distancing. So we've started that. What we look at is we want to see declining cases. We want to see declining positivity rates. We want to see increasing pace in vaccinations. But we're going to do this step by step. With the variants out there, we know there's the threat for it to pick back up. So, as cases step down, we'll step down on the restriction side as well. So we will do this thoughtfully, and we will do it in steps. Again, I don't think you just rip off the Band-Aid, which you've seen in Texas and Mississippi. We're just too close to the end. And I want people to realize that's got to be part of how we think too. We are so close. 2 months and 2 weeks, 3 weeks until every single adult who wants a vaccine can get one. Think about how short of a time period that is. So while we will loosen restrictions, provided that we continue to see the good direction that things are going in, we will do it in mind with being so close to the finish line. We don't want to leave people behind. Sarah Ladd from the Courier-Journal.
Yes, thank you. Are there any more details available on those new variant cases that Dr. Stack mentioned? For instance, where are they in the state? How many? And was there any travel involved with the patients?
Let's go to Dr. Stack. I think he at least has the counties.
Hey, Governor. Yes, so the most two recent ones we got today were one in Jefferson County, one in Fayette County. This harkens back in my memory to when we were doing press conferences in March of 2020, when we said we know the disease is here, we just don't know where it is yet, and it'll take more time and testing to find it. Now that B117 variant is here, it will spread naturally. What they saw happen in other areas, because this is more transmissible than the original COVID virus, this is likely to become the predominant form of the virus that's in circulation. I think by springtime, mid-spring, they were saying this would be the predominant form across much of the nation. So as far as travel history, I don't have that specifically. What they do is take positive samples and then sequence them. And then they look back and they do further looking in for some of those. But when it becomes more common, the travel history won't be quite as important. It'll be predominantly that we all have to take the measures necessary: vaccination, masking, social distancing, to keep it from spreading and propagating. But the two newest cases we found in the last 24 hours or so, I think, were one in Jefferson County and one in Fayette County. Governor?
Tom Latek from Kentucky Today.
Thank you, and good afternoon, Governor. My two questions as usual. One is there anything new on expansion of our vaccine allocation to the state, and more sites, are they in the future? And also, what is the status of contact tracing? Haven't heard anything about that for quite a while.
Let's see, new vaccine centers. You snuck a third one in there. So on expansion of vaccines, we get that news on Tuesday. I'll be on a call with the White House. I think it's around 10 or 11 on Tuesdays. And that's when they've announced it each time. This week, one thing that's different is we don't get any Johnson & Johnson. We already know that. So they shipped out all of it that they had pre-manufactured last week, which is about 36,500 doses. This week, there won't be any. So while we expect at least a little bit of an uptick on Moderna and Pfizer, it might not make up for no Johnson & Johnson this week. Now, as we move into the future, I think it'll trickle in next week. But certainly with Merck now manufacturing the Johnson & Johnson vaccine again, those numbers will start picking up really seriously and significantly. The Pfizer numbers, because I was on a call with their CEO last week, are going to pick up very significantly as well through March as we go. But we will have a better idea that after tomorrow's call, and we'll give that information tomorrow night, vaccine centers will announce on Thursday. We are in advanced talks on opening a Shawnee vaccination location. We now believe that we can do that with current supply as it increases, scheduling out a start of that location. Contact tracing continues, but at the level of virus even that we're at now is more of a challenge. We do have a lot of partners that are helping us out in between schools and work and the rest, but we're definitely now certainly some of the folks that were doing contact tracing are now doing vaccinations, and rightfully so. Stu Johnson from WEKU.
Good afternoon, Governor, and thank you. I think this may be a question for Dr. Stack. Still on the variant issue, following up on what Sarah had asked about the variants, and I saw a report over the weekend where a health professional was saying nationally, he termed it as kind of being in the eye of the storm. And so I guess the question I have is, with proper masking and social distancing along with vaccinations, can we stay ahead of the variants in the months ahead?
Let's go to Dr. Stack.
We can't. The answer is yes. We can stay ahead of the variants if people follow the measures. And so, one, as soon as you have a chance to get vaccinated, please get vaccinated. That's absolutely imperative, because the evidence continues to increase. That's why the CDC gave these new guidance today. It continues to show the vaccine is incredibly effective at preventing you from getting deathly ill and sick, but also hopefully from preventing you from spreading infection to others, or maybe even from getting infected at all. And so if we get everyone vaccinated as quickly as we can, and if people wear their masks and socially distance whenever they're out in public, I think we can stay ahead of this. And I think that this is not imperiling our ability to get to the end of the journey. It just means that people have got to recommit and not give up before we cross the finish line. We just got to hang in there for a few more months. And I think that, yes, we do have a chance to prevent this from becoming a major problem, but only if we continue to rally and see this through the end. That's no different than a runner crossing the finish line. You can't give up before you've crossed the finish line. And we're so close, but we're not yet past it. So just hang in a little bit longer. Governor?
Next, we have Al Cross from Kentucky Health News. At least I think we do. Okay, we'll come back. Next, we have Piper Hudspeth Blackburn from the Associated Press.
I'm here now, Governor.
Oh, okay. Go ahead, Al.
Sorry, technical problem. I don't do this enough. I have a long one and a short one. The short one is, who's your contact in the Biden administration that you referred to? And the long one is, our lead story on the rural blog today says that there may be a problem in some states and rural areas because of resistance by Republicans to getting vaccinated. About 1/3 of Republicans say that they will definitely not get vaccinated. And there's already a Republican pollster working on strategies for that. So is this a particular worry in this state? And if so, what are you doing about it?
So first, Julie Rodriguez is the contact for all governors in the Biden administration. I think she's in the same position that Jerry Abramson was in under the Obama administration. I think we do see hesitancy, in different areas, but I have seen the polling that suggests that there is some significant hesitancy among some Republicans. So we tried to start early on addressing some of that, having the Senate president here in Kentucky, the Speaker of the House, vaccinated when we stepped forward to do it. Since then, we have had other leaders, or we've offered to other leaders there. We, like you, want to look at the data, and figure out the best ways to communicate. Certainly in other areas, that's through community leaders inside that community. So we will have more asks moving forward of those that are trusted by, I think it's just this portion of Republicans, and it's critical to get them vaccinated. There aren't any Democrats or Republicans when it comes to who the coronavirus will infect, and I want everybody to get vaccinated, even if you stood outside the window here and screamed in the midst of one of these press conferences. I want you to get the vaccine. We all want to move beyond this, and I want to listen. If there are leaders in or outside of the Republican Party that have ideas about better ways to convince isn't the right word. I think it's educate. It's to provide the information. But I do think, and Al, you see a lot of data too, so I'm sure you have opinions on this. I do think that hesitancy will wane a little bit the more and more people get vaccinated. When we look at a quarter of the population now, once we reach a half or 2/3, today's CDC announcement where you need to wear your mask in public everywhere. You need to wear your mask at work. But at home and private gatherings with other people that have been vaccinated under the right conditions, you don't. That's a pretty good incentive too, that hopefully reaches beyond politics. Okay, now Piper Hudspeth Blackburn from the Associated Press. Piper, you get to ask us the last question of the day. All right, Piper, if you want to send us the question, we'll get you a response in writing. All right, everybody, good job. Good job at fighting COVID. What we're seeing in the numbers means you are doing the right things to protect people around you. It means we're trying to carry everybody to the finish line to defeat this virus. Remember, May 31st is just around the corner, and that's when, and we believe every adult who wants to be vaccinated can be. Don't get confused about the CDC guidance from today. In public, on the job, wear the mask. If you have been fully vaccinated and everyone else has been fully vaccinated, it's small private gatherings. Now you don't have to wear one and don't have to engage in social distancing. That's a good incentive for all of us to get vaccinated. But again, in public, in large groups and the rest, please continue to wear this. We are so close. We don't want to lose people that we can bring to the end with us, and we're going to defeat COVID-19. We're going to do it this year. We're going to do it together. We'll see you tomorrow at 4. Thanks.